this is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator. You're watching Health Links and also Aging Strong, which is found on Health Links. Today, my guest speaker is Liz Olson. She's got a background in social work, but right now what she does is she's an advocate for Deaf Inc. And that is from Aries Company. Is that how, am I pronouncing it correctly? Aries Company.
ARES is the acronym for the next slide, Advocacy, Resources, Education Services.
Okay.
So
So,
it's a piece of Deaf Inc.
okay.
If you look at the next slide, it's core services. I work for the ARES part of Deaf Incorporated as an advocate.
Great. Wonderful. Thank you for that correction. So Liz is going to talk about some resources and give us information about hearing loss and for people who are suffering hearing loss later on in their life. So Liz, welcome to the program.
Thank you.
Yeah,
Thank you for having me.
so I'm curious what brought you into this line of work? And I was sharing with you before we came on how I was really excited to have you on because, personal reasons, families are hard of hearing and also because of that, they wear hearing aids. So what got you into this line of work?
Well, I have a personal experience growing up with hearing loss. I was diagnosed with progressive hearing loss. Never knew that I would be completely deaf at age 45, but I'm also a social worker, so I like to help people. And this just opportunity came along. I was looking for new work. I was actually working for a completely different line of work, and that company closed. That's when we hit COVID, and I tried clinical social worker, and when that didn't, wasn't full time, so I ended up with Deaf Inc. I love it. I think it's wonderful advocating for everybody. I'll explain more the population that we serve, everything from hard of hearing to deaf culture. So.
Mm. Oh, wow. So yeah, a colleague of mine heard you present at a separate location in the Boston area and emailed me right away and said, you need to get in touch with Liz. She did a great presentation and this is the topic. And so that's what I did. So I'm very happy to have you here, truly.
Yeah.
So I know you have a presentation to share with us. So I'll have you put that on.
So, like I said, this is a logo, Deaf Incorporated Advocacy Support. We work for access, awareness, and achievement. I'll go through our goals and values is really to help everybody with independence, communication, access, and to note that it is deaf, blind, hard of hearing, and late deafened people. So there's a very large population with a very diverse amount of needs, different needs. So we serve everybody. Again, you know about me. I am a social worker background. And today my topic is hearing loss. What are the impacts of hearing loss and what are some solutions? And those kind of specific to what Deaf Inc. can offer you, as well as other community resources. So again, who are we in terms of Deaf Incorporated? We are the only Massachusetts community-based, multi-service 501c3 nonprofit run by deaf and hard of hearing adults. So everybody in the company, all staff have some kind of hearing loss. And yes, I am practicing sign language, but we can all communicate together. We are funded by federal, state, and city contracts, private grants, and donations. And we serve deaf, blind, hard of hearing, and late deafened adults in eastern Massachusetts. So, just so you know, deaf may be born deaf. They may be part of the deaf culture. Somebody who's hard of hearing might self-identify as deaf. It's fine. It's just to show the spectrum. Late deafened adults are usually born oral and later in life lose their hearing. So there's just a lot of different ways to say it, and not all of it is the same. Somebody might say, I'm hard of hearing, now I'm deaf, but I'm oral, so it's very complicated and confusing. But anyways, we serve everybody in the whole spectrum. Our offices are in Watertown, which is our new main office. We moved from Brighton. We're in Hyannis, New Bedford, Salem, and Lawrence. So I'll show you the map. We are the eastern part of Massachusetts. Everything from Lawrence, Salem, Watertown, New Bedford, and Hyannis. We do work with Center for Living and Working in Worcester and Viability, which covers Western Massachusetts. As our wonderful other acronym is DILS, the Deaf and Hard of Hearing Independent Living Services. So we're all striving to help people with their independence, empowerment, those types of goals. And again, within Deaf Incorporated, we have different core services. I work for the top one, is an acronym, we call ourselves ARIES, Advocacy Resources and Education Services. We have Deaf Blind Community Access Network, which actually just changed its name to just Deaf Blind Services. We're getting bigger, which is really great. Everybody has, dual diagnosis, deaf and blind, and tough. It's a wonderful program. You learn about touch, protactile communication, which is another whole language in itself. We have ASL, which is American Sign Language. We teach the community, we teach consumers who are hard of hearing, we teach people who are already signing to increase their communication access. Other education and training can be wherever the needs are. English, we have financial training, we have some citizenship things. A lot of that is language access. So if you don't have English, how else can you get that information? So you do it in sign language. And that's a great way of getting people to training that's not in the community already. And again, outreach, things that I'm doing right now, where we go to fairs and conventions and things like that, just trying to get everybody to know who we are. So a little bit more about what I do under the ARIES program. Advocacy means just support, to understand your rights, to stand up, speak, voicing your needs. I know personally it took me a lot of years to figure out what the heck that looked like. So, and when you have a partner, you have an advocate to help you do that, right? Or help you make that phone call. Skills training, again, I mentioned some of these, could be like balancing your checkbook or learning get the savings account, how to budget your money. Information and referral, we just, sharing resources. Peer counseling, again, everybody's experienced hearing loss. So it's a chance for people to learn from others, share their stories. We have a committee, Hard of Hearing Late Deafened Committee, that offers socializing, which is great for people to stand up and share what their needs are. Again, we offer a lot of assistive technology. I have a whole slide on that, so to get more of that. Classes and tutoring, again, is kind of part of our ARIES service education. The cost of services, all deafening services are free to our consumers. It's an example of getting advocacy, appointments, classes, and events. If we need to purchase equipment, there is a fee. Right? Can't get a free hearing aid, but we can help you get loans and grants and things that can help you get those things. So, just for the audience, how many deaf and hard of hearing people are there just in the state of Massachusetts? Think about it. Think about how many you think might be there and how big the state of Massachusetts is.
I'd say maybe thousands of people. I don't know, so it's just maybe they they qualify as deaf or hard hearing and maybe they're not aware of it? So is there like an
That's a great point. I think this is from the census, but there's a lot more. The estimated population is actually over 1 million.
wow.
1,405,983, and the state population is over 7 million, 7,020,060. That's about 20%. And as
Wow.
Debbie just said, what about the people who don't know it or don't report it? So I think it's a much higher number. And it means that we need to do something about it.
Yeah.
Or, be more aware and be more open to making things accessible. I'm going to say a little bit about deaf culture because the rest of the presentation is really more for hard of hearing and late deafened population. And it is a unique cultural and linguistic minority. Sign language is the primary language. And I think that's kind of what kind of separates it from English, as a minority, because they have their own language. And how many people know sign language when they grow, we all learn English. So anyways, the American Sign Language is the language used in the United States. Sign language can be many different linguistics, like French Sign Language, German Sign Language, just like oral languages, there are many sign languages. But American Sign Language is the name for the one used in the United States. Identity is shaped by language exposure at age 0 to 3. Caregiver involvement and influence, the type of school that kids attend, and other factors. So I read a wonderful book about mainstreaming kids and how, they go to school and they've never seen another deaf person. Their family is all hearing and they were born without hearing or with very little hearing. So it's really amazing to see how kids develop identity, how they develop language. And now I see some of the adults who have gone through mainstreaming or an education that really didn't give them language. So we have English, we have sign language, we also have visual gestural language, kind of like more of a charades. How do I show somebody I don't have oral language? How do I show somebody my needs? And again, the deafblind use protactile language. So it's really fascinating and yet a challenge to meet those needs. Anyway, so for the deaf, we're talking about born deaf. They don't want to use, a lot of them don't use hearing aids or cochlear implants. There's a big sense of community. And there's a different way of doing things. Just get somebody's attention, you tap them on the shoulder or you turn the lights on and off. So that's a whole nother thing. I don't want to say too much because it's not my forte, so to speak. But anyways, so I'm not going to be talking about deaf. I'm going to be talking about deaf hearing loss. So types and causes of hearing loss. So I'm going to actually start on the right side of the slide with the conductive. If I may experience something, or the one on the bottom, earwax, or you have a cold. And suddenly you have a cold, you feel like I can't hear well. Got a cold. There's something kind of sinus-wise blocking your hearing. Or you have wax in there, and you can go to the doctor and get the wax removed, and you can hear again. So things within the outer ear that are preventing the sounds to going through, conductive type losses. We have a mixture in general of head traumas, infections, and genetic disorders can also cause hearing loss. And the more common one is called sensorineural hearing loss. And I'll explain that more on the next slide, but loud noises, blasts, and explosions. I know people in Boston may remember the marathon bombing. That impacted a lot of people's hearing. and other bombs and types of explosions, construction. Auditory tumors can block hearing. Drug side effects, there's ototoxic drugs that can cause hearing loss. Noise damage, again, the same way I mentioned construction is noise. Also music. A lot of musicians can lose their hearing over time, loud concerts, things like that. And aging at the top. It should be on the bottom. I don't want to scare anybody. There is as we grow older, we can lose our hearing loss. It does not mean that everybody who grows older will lose their hearing loss. I'll get to the next slide. A little bit more about the sensorineural hearing loss. We are talking about the very inside of your ear. If you can see this purple snail or shell shape purple area here. It's in the very inside of our ear. And inside of that are hair cells, which transmit the messages to our brain. This makes me feel like I could cut off my ear and still have hearing. A lot of our hearing happens inside. These little hair cells pick up the sound waves that have to come in all the way through the ear, through the bones, and into the cochlea. So again, with conductive, I forgot to mention, you could have these little bones in the middle of the ear break, and that's called conductive hearing loss as well. But we're talking about the middle. Again, sorry, the hair cells. There are a lot of different reasons why those hair cells can break down. The aging part is called presbycusis, like any other part of your body, right? Things start to wear down, your muscles wear down, or your bones wear down, parts of our body. So the hair cells on that are most used can get the most amount of damage over time, and then you start to lose your hearing. Again, exposure to loud noise, disease, ototoxic medication can also cause those hair cells to start being damaged. And again, note that not all older people will have hearing loss. So how do you know? We do recommend going to your doctor or specialist. You get what this test on the right side is an audiogram. It shows frequencies from the left to the right on the top. That is low tones at the low 250 frequency to the high tones at the 8,000. Don't get too absorbed in this. It's kind of very complicated and backwards, but these are the high-pitched sounds like the birds and the trees whistling, and these are the low tones. Hearing threshold level is the loudest that these tones need to be for you to hear them. So this person is showing the low tones in between 20 and 30 decibels, which if you go back to the one on the left tells you that that's slight loss. 20 and 30, you can still hear whispering and water dripping. All right, so the low tones are pretty much okay. X means the left ear and the red means the right ear. So just showing two different ears on this chart. But anyways, it's tracking how loud this sound needs to be until you hear it. So when you look at the 8,000, you see a drop. It just starts between 2,000 and 4,000 frequencies. These are the higher pitched tones. This is kind of the average drop. As I mentioned, the cochlea, the hair cells at the very end are the high-pitched responders. So if every single sound is going through those responders, those cells are going to be the first to break down, right, over time. If that makes a little bit of sense. And then you look at the audiogram of familiar sounds, it just gives you an idea of where the loss occurs. So if you have profound hearing loss, things have to be as loud as an airplane, a chainsaw, or a truck for you to hear them. That's what that means. But if you look up here, it only takes slight loss or mild loss. If you look at the banana-shaped yellow area, you start to see some letters. Those are the, it doesn't take much loss before we start to lose some speech sound. Sh, sh, R, M, D, B sounds can start to fade earlier. So just to be aware, that you need to go to an audiologist. They will explain it all to you much better than I can here. But this is what you get. You get a chart of your hearing and kind of a better understanding of where you fall. How else can you find out? Maybe before you go to the doctor, you're feeling tired, especially after going out or having conversations with people. Like, this is wiping me out. This is really hard to hear, right? You feel withdrawn because it's no longer fun to go out to dinner or to social events. Maybe because you're feeling tired, but other reasons, right? It's not as fun anymore. You get frustrated because you feel left out of a conversation. Maybe you're saddened because you can't hear your grandchildren. And just an FYI, kids, if you notice, have high-pitched noise voices. And those are some of the high-pitched frequencies that are harder to hear when we get older. So again, if you're tired, you're feeling withdrawn, things aren't as fun, you're frustrated or sad, those are common responses when you experience hearing loss. And some of these don't go away. It can be very tiring to hear when you have hearing loss. Okay, so just be aware of these. And maybe this is a reason to go, I should go see my doctor about getting my hearing tested. Further impacts, just so you know, the American Academy of Audiology has found that nearly 33% of adults 70 years and older have a hearing loss that impacts daily communication. Now, I want to add that it starts a lot younger, but that's a fact that was found from the American Academy of Audiology. Hearing loss in itself can make it more difficult to interact with your peers. So how do we can decide to have less social engagement, and that isolation can increase our risk for depression and mood swings. So just being aware of that. There is kind of a trickle-down effect that if we don't get help for our hearing, we may start to isolate, and that can lead to depression. But using a hearing aid regularly can decrease your depression. And I will talk about hearing aids. I will talk about a lot of other different supports that we can get that can help decrease that risk of depression. So, why do we not get help? There's more challenges. There's more challenges. Denial, right? I'm not losing my hearing. People don't speak clearly, right? The restaurant's too loud. Denial. Not quite ready to accept my hearing loss. Now, I, as a social worker, am aware of Elizabeth Kubler-Ross, and she studies the 5 stages of grieving, which is kind of related to losing a loved one. But I can relate it to losing our hearing. We have lost something that we used to have. And sometimes we need to grieve that loss. So we may find ourselves in those 5 stages of grieving. And the first one is denial, right? We're talking about, it's not me, it's not my hearing. People mumble, right? Everybody else is mumbling, the restaurant's too loud, whatever you want to do. We might go through the stage of denial. We might have shame. I don't want anyone to know that I didn't understand them. It's easier to lie. A lot of us do that. rely a lot. Yeah, I heard you. I'm fine. You show up to the wrong event, the wrong time, wrong day. Um, but anyways, there's a lot of shame how you're going to be judged by others, or how you're going to look. If I put a hearing aid on, people will see me differently or see me as stupid. There's a lot of different shames and stigmas in our culture about hearing loss. Another important reason or barrier, we may have fear, right? I don't know what to do if I lose my hearing. Again, judgment from others. What will others think or say? We don't know the unknown. We know what we know, but we don't know the unknown. And of course, the last barrier is often expense. So unfortunately, right now, hearing aids are $2,000 to $3,000. And how many can really afford that? There's only one insurance that will cover it. So we're working really hard to get a hearing aid bill that will make it more accessible to everyone. But in the meantime, they are expensive. Um, so a lot of just the stigmas and barriers in front of us that make it challenging to get help. So don't feel badly if it takes you time or you experience any of these. But we do have solutions. We tried a lot of broad range of solutions. Okay, I hope you're all laughing because these are not the solutions we are going to offer you. These are the old solutions. A horn or this humongous pack is a very, 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 very old one of the first hearing aids. Um, uh, I do believe in humor in medicine, so I hope you have a little laugh about these. We've come a long way, and we can be grateful for that. So, assistive technology. Again, there are many, many different systems for very many different levels of hearing. Like I showed you before, that was the first hearing aid, a big box or a receiver and a transmitter. And some people had to tape the big box on their back and could only get one earbud. So hearing aids have come a long way. You can see in the picture. We have everything from the tiny little in the earbuds to over the ear, the larger over the earbud, called BTE, behind the ear model. As much as I love this, I do warn people that make sure that you can handle them. Make sure that everything allowed now is automatically charged. But back in there, we do have batteries. If it has a battery, make sure that you can handle the battery and getting it in and out. My mom has a small one. She's lost it twice. They fall out. These little tiny the molds. The molds can be different sizes to fit your ear. Anyway, so there are lots of things. I can't market any different hearing aids. There's a lot out there. That's why you go to the audiologist to get the best fit, best size for your hands, your other needs. We do have over-the-counter OTC. We are trying to market some over-the-counter hearing aids. And I say we, the Hearing Loss Association of America, was part of creating the bill to allow hearing aids to be sold on the market. Yeah, I'll talk a little bit more about over-the-counter aids for very mild hearing loss, just giving people a chance to try something, a little bit of amplification for a lower cost. And then especially specialty vendors just really means an audiologist. Different audiologists sell different aids. Some audiologists only do the testing. It can get kind of confusing, but there are always updates on new aids coming out. Artificial intelligence, as we all know, aids now have connections to Bluetooth and other systems. It's a lot of technology. For me, it's very hard because we're wearing technology, and technology can be very confusing. But we've gone from a box to a tiny little thing. We're trying to make them better. I'll get a little bit more on that a couple slides. Again, the cochlear implant allows someone who has no hearing, no residual hearing from a hearing aid. What they do is put an implant in, bypasses the outer and the inner middle ear into that cochlea, that purple part that I was showing. And it's a wire that has electrodes. So those electrodes are taking the place of all those hair cells, responders, and the electrodes then send the messages to the nerves, to the brain, and you can get your hearing back. But I found it magical. I lost all of my hearing. I couldn't hear a thing. And I have a CI and I got my hearing back. It changed different from everybody, different ages, accept it, don't accept it. I'm not advertising it, but it is an option for many people. And that's the bottom. The implant is up here and the wire is way inside your ear. And this processor helps. Again, we have assisted listening devices, FM systems, apps, and now Bluetooth connections. I'm going to talk more about all of these things. So, apps on our phones. Whether you have an Android or an iPhone, there are ways to help you increase your communication. There are apps that can translate speech to text. So like the middle picture shows closed captions. We can have individual programs on an iPad or a phone that we can use to read. So if you can't hear, you hold it up to somebody, like a microphone, and they speak, and then you can read the words. And a lot of those phones also allow it to make the font bigger, change the size and the colors to make it more accessible. And of course, in the middle, there's a television. Television has captions. They're getting better. That's the FCC. Now, if there's a new bill, I think a year or so ago, bars, if you want to watch a football game or a sports game in a bar, you have the right to ask for captions. They actually, ADA, they're required to put the captions on. They usually don't until you ask, but it is the law. And on the right side just shows, if you don't want a hearing aid, that's fine if you don't have one. This is a type of amplification system that you can hook up to your TV. It's a Sennheiser German product. Here, earmuff type buds, and it connects to your TV. So you can turn the volume up, but you won't bother your neighbors or your spouse or your family, but you can have the volume louder than other people and hear the TV. Other types of communication and alerting systems, smoke detectors and carbon monoxide detectors can now have strobe lights. They can also be connected to a clock radio device that has that can show you this back model in the back right corner here says door. There are models like this that will say fire. This is a bed shaker. This small round gray piece can plug into an alarm clock and shake. So, of course, you're not going to hear the beeping, you're not going to hear the alarm, but you can be shaken awake. And you can use that. I use that every morning to get up, right? This is a doorbell. So all of these can be connected. The doorbell rings, the bed shakes, the lights go off. This lower right model here is a strobe light. They're much brighter than any other normal light. You can also use a regular lamp to blink, setting up regular lamps to blink when somebody rings the doorbell or when the phone rings. So really, essentially, we're replacing sound with light and touch systems. And in the back, left corner, I'm sorry, on the left side shows a captioned telephone. Unfortunately, it does require Wi-Fi, which is hard to get now. It can be expensive, but we have captioned telephones and this the left side computer monitor shows somebody big in the screen like this. This is a video phone. This is much easier for signing, right? Video phone, sign to sign. Kind of many of us use FaceTime, right? You can see the person. You can read their lips, right? Now phones require captioning, so you can have a FaceTime with captions and the view of the person. So video is very big, especially in the deaf culture. It's a lot bigger than it is in the hearing loss culture, but we can certainly use some of these things. It's always more helpful to see the person. I don't know if any of you realized during COVID, your hearing went down because we were all wearing masks. One of the tools that is often used and often not known about is lip reading. Some of us can take courses or have training in lip reading. But if you notice that when we had masks and COVID, your hearing went down, it's because you lost your ability to lip read. So that shows the importance of video, both in signing and lip reading. So there's a lot of learning systems that we can help you get and set up according to your needs. More on applications, more on what's called loop systems. Again, your phones can have captioning, live transcription, speech to text type caption phones. The loop systems can often be found in public places, such as churches and libraries. It's hard to know. There's a little symbol for it, which I should have put on the slide, but if you have a hearing aid or a cochlear implant, which has a T-coil, sometimes you have to advocate now for the little chip in your hearing aid, you can use an FM system. I know my church has one. I call it Magic. I put it on. It makes the person who's say the minister is 800 feet away, 1,000 feet away at the microphone. It makes it sound like they're right next to you. The microphone brings the sound closer and louder and clearer to you through the FM waves. And there's a loop that can be set up. It's actually a physical loop. And we can have portable loops now. I can show you more about that. But now we have Bluetooth. I'm sure if you've heard of Bluetooth. Bluetooth is another type of wave in the area. It's all new technology to me. But Bluetooth is now taking over FM systems, but they all work together with aids and with other types of microphone systems. In the product on the right-hand side, I just want to mention another great type of help for people who don't have hearing aids, or it's an amplification system. This is a pocket talker. So again, you can use different kind. You can use an earbud. You can use over the ear, the old headphones. You can also use the product on the left, which is a wire that connects to that does connect to your hearing aids and cochlear implant processors, right? So when you have an hearing aid, you can't put things through here. Doesn't work that way. Our microphones are up here. So there's a loop that specializes in that. That's all I want to really say about that. Left-hand loop. It takes the place of these earbuds and systems. There are a lot of feeders now that have loop systems. Sometimes we have to advocate for the left-hand loop. It's complicated, but that's what we help you do. Find the right fit, the right system, what works for you. But we can now go to the theaters. We can have loop systems. We might have to wear something. But now also we can just turn on our T-coil switches and you can hear. We've advocated for open captions in theaters. Captions are there for everybody. It's just sit in a certain spot and you can read all the captions and go to the theaters. So this is all about advocating for what we need when we can't hear, making things accessible. So a little quiz. You're paying attention, but it's just a question. I'll take a little break. Ask true or false. I can buy hearing aids at the store on my own. We're paying
True.
attention, true.
Yeah.
But there's always a but. Yes, we've tried to make over-the-counter hearing aids affordable, easy to get, and they're really good for mild hearing loss. Just be careful. If you suspect that you have hearing loss, please see a doctor first and get your hearing tested so that you know. I mean, even at $300, you don't want to spend your money on something that's not going to help, right? You might need more than that, and then you'll be disappointed and maybe less inclined to try something else. But if you know you have mild hearing loss, then maybe this is a great product to try. Like get a little more amplification, especially when you're with your friends in social areas. So when you see you understand your level of hearing aid, just be careful. What you see in the box is all that you are going to get, right? Right, so if you buy Cocoa Puffs, you're only going to get Cocoa Puffs in the box. You're not going to get any Cheerios. You're not going to get anything else. You're not going to get an audiologist. So that's one big problem. It's great for self-help and advocating. You're not going to get an audiologist help you to use it, figure it out, program it, or anything else. So just be aware of that. True or false? One more. Hearing aids will fix my hearing loss.
I would say true.
It's actually false. It doesn't fix. Fix is a tricky word. It will help your hearing loss, but they're not like glasses, right? So they can help you amplify sounds, but they can't always help with word clarity and other challenges that come with living with hearing loss. So they do help, but they don't fix the problem, right? And the sound through a processor doesn't always sound like what it used to sound like with your ears. Instead, we're doing the best to get the best technology. We're working on programs that help hit just what your audiogram says you need help with, right? So get blasted with all the other sounds that you are okay hearing. We've come a long way. But you might still found you'll still be tired at the end of the day, right? You may still feel a little disconnect after having conversations in restaurants. It's still hard. So you want to be careful about the word fix. So other ways we can, getting off the technology and the hearing aids and things like that, what other ways that we can help you just communicating, right? Access to communication. Ask a person to speak to you, right? Please turn and face me. Please speak clearly and slowly. Do not cover your mouth, right? Like I said, we learned in COVID, we need that lip reading help. We might not even know that we have it, but I can guarantee that if you do a little experimenting, you'll realize you're using it. Ask them not to raise their voice, right? Shouting doesn't help, right? We have our amplification. We have our microphone. We don't need you to shout. And to be mindful of body language. So if I tell you, we are not going to talk about this today, that doesn't help, right? Make sure body language matches. If you speak in a monotone voice, you're never going to have any clues about what the heck you're talking about. So show some body language, right? Am I happy? Am I happy, Joy? Okay. Anyways, also, that's things that you can ask the person speaking to you. Or what I do is clarify directly to you. I said facing you. I wanted to mention if you go to the doctor's office and you bring a friend or a family member, who's the doctor going to talk to, you or the other person? And that's something I want to advocate. Just because you're hard of hearing does not mean that they don't speak with you. You are the patient. You have the right to speak to the doctor. They should not be talking to somebody else. Even if you have an interpreter, they should be talking to you. Okay? That's your right. Anyways, other things that we can do, have paper and pen, ask somebody to write down. I really want to hear you, but I'm not understanding. Can you please write it down so I can understand you? If I want to ask them to rephrase or use a different word, it's a way of clarifying the what. But I have a funny story for you. I went to a fast food restaurant. It was already, I was so proud. I walked up, I said, I want a hamburger, French fries, and soda. Had it all prepared. They started asking me a question. Like, I want what? I just told you my order. What are you asking me? That's just not the way it's supposed to work. I told you I want a hamburger, French fries, and soda. What's happening here? I don't get it. I don't understand. So I paused. I looked around for help. Nobody understood. The guy behind the counter finally understood. Said, "You want American or provolone?" I said, "Oh, cheese. Cheese. Cheese is a word that is very difficult. There's no lip reading. Cheese. It's almost an invisible word. And aside the fact that I ordered a hamburger, you think I would have ordered a cheeseburger, I would have cheese. But I ordered a hamburger. But apparently they're required to ask that question. But he got it. He understood. Instead of saying cheese 100 times, do you want cheese, cheese, cheese? I have no clue what he's saying. So that's a word that needs to be replaced with something else. American, provolone, Swiss, something that you can say, oh, I understand now. Use a different word, please. I'm not understanding that first word. It doesn't matter how many times you say it. Another way to clarify telling what, I didn't hear you, right? It annoys somebody 100 times saying what all the time. So what did you say? What did you say about the fox jumping over the something? So they focus on that something. I'm still working on this with my mother, who likes to repeat the whole entire phrase, which still means that I'm always going to miss the 10th word out of the sentence. But if we try to focus and ask the person specifically, can you tell me what you asked me about on my hamburger? What did the fox jump over? So I heard fox jumped over something, but I don't know what that something was. So clarify the what. That helps the other person. And again, use a speech to text app if it helps. Or use a pocket talker. I'm not recording you, I'm just helping me understand what you're saying. Right? A microphone system. And for everybody, just to be patient. Try not to rush. Everybody, accommodate somebody else's needs. And the time it takes for me to understand that cheese meant Swiss cheese or provolone, right? So those are something you can do without any kind of device or anything. Communication strategies. And Craig, you're not alone. Famous people also have hearing loss. The person on the right is William Ellsworth. Unfortunately, he was called Dummy Hoy. He's a Major League Baseball player back in 1888. He played for Cincinnati Reds. He was really good. Anybody else still watch baseball? You'll know the sign safe and out. Those are American signs. Those are signs. developed probably when William Ellsworth was playing. If you watch football, the huddle in football is a sign language deaf player accommodation, and it's still used today. On the left, Paul Simon. He's in his 80s. He just started to lose his hearing loss. He was devastated. He can't hear enough to sing his favorite song. I think it's Call Me Out. But anyways, he was going to retire at the base of this. He's now going to play in Boston in this summer, okay? So he's back. He's coming back. But he hit a hard loss, and he's kind of grieving that loss. And, a career as a musician. So everybody gets deafness. We're all here. It's a big community. We can all help each other, share our stories, help you get access to communication, feel more independent. And DEFIC is just one of many agencies that we can pair up with you. We'll advocate for you and with you, share our resources to help you get what you need. There are, like I said, many, many, many other resources in the Massachusetts area. Mass Association for Deaf actually has hard of hearing services. Sometimes things get hidden in names. The Hearing Loss Association of America, the Association of Late Deafened Adults is a very community-based, whatever works. We welcome everybody. Deaf Seniors of America, more for elders. New England Home for the Deaf and Thompson House are places to live with other people who have hearing loss or deafness, use sign language. So there's a lot. They're state-based, they're federal-based, they're community-based, nonprofit resources. Oh, any questions?
Wow. I have a lot of questions, and I know I have a lot of homework to do. And I say homework because you've given me so many many resources, and also different tips to help me be able to help my mother who is hard of hearing. So I'm curious and was wondering, you mentioned for people who want to go to church and who are hard of hearing. What is it that they could ask for in the church? And do all churches in Massachusetts have this ability to help those who have hearing loss, who want to attend church, but they're not able to?
Well, that's a very good question. There are many churches, and not all of them have systems, but I really wish I had the visual. There is a symbol. It looks like an ear, and it means that there's an FM system in the building. And you could ask, do you have an FM system? Because sometimes it's an invisible wire that's been looped in the sanctuary. It could be the whole sanctuary or chapel or a section of the church or the library that, sound waves, things are invisible. So it's very hard for me to explain, but the technology of it, if you sit within that loop, it connects to the microphone. So when you have a T-coil or when you wear systems have advanced, it's a little bit different, but there are, let's start with the basic receiver and transmitter. The church has a transmitter box within its audio sound system, and you wear the receiver. Maybe you wear those headphones. Then the loop will work. The microphone is carried to those headphones. So instead of sounding echoey and thousands of feet away, the sound is right here.
Mm.
So it helps bring it closer and louder.
Mm-hmm. Okay.
On a more advanced system, a loop may be there, and all you have to do is turn on a T-coil within your hearing aid. And that does the same thing from microphone to processor.
Okay.
They do sell portable loop systems. I went to a retreat and I wanted to hear. I put down a wire. I gave the wire to the person in charge. They wired around the chair system, and they were able to connect it to the microphone that everybody else was going to hear through the speakers. I'm hearing through the FM because I have the processors with the T-coil switch. And I am going to emphasize T-coil. That is a computer chip that is in a hearing aid or a cochlear implant processor that we now need to advocate our audiologists to put in, because they're getting rid of them, making things smaller for stigma. You're going to lose out on the T-coil chip.
Okay.
Targeting
Yeah.
size for a chip.
Yeah.
It is confusing. It needs to be better educated. Like magic. I don't really understand it. It's technology. But Old South Church in downtown Boston has one. Has a loop system.
Okay.
There are a lot of theaters in Boston area now have loops.
For people who are interested in taking the American Sign Language course, I think in your beginning slides, one of the programs offered are courses. Do you have to be a member of an organization to be able to sign up for these courses?
Well, meaning member, if you become a consumer, just basically means, meeting with us, paperwork, a little bit of an introduction, paperwork, and understanding who your needs, then everything can be free. If you are part of the community, you're more than welcome to take our classes. There is a fee. I think it's $275, but if you think about 10 weeks of 2-hour classes, it's great. It's a real bonus. You get a lot out of it. And you can look for other community classes. But definitely, you can go to our website, Deaf Inc., or Google Deaf Inc., and for a lot of different classes on that.
So what's the one or two things you want people to come away with your, from your presentation?
You're not alone. We are community. We're advocating to help everybody find their own independence, however that might mean for that person. So it's self-dignity, your definition, not my definition. And we're all here to help share our stories. I think it would be a lot of socialization is important, just that peer networking. I only talk about a fraction of what's out there, and we really hope that we can share. The more that we share, the more we can really advocate for each other.
Yeah, wonderful. I appreciate you sharing your knowledge with us, Liz. You really covered so much. And I hope that a lot more people who are getting to that point where they feel like, their hearing is starting to be getting in a way of them enjoying life, can reach out to you. So, or people, in their area, if you are, watching this outside of the Commonwealth of Massachusetts. So, I appreciate your time, Liz. Thank you so much for being on the program.
And also, we're looking to develop a day program for people who are deaf and hard of hearing. So if you have feedback for us, what would be an ideal way to go out? What do you need in order to make that an ideal place to go? Let us know.
Wow, that's awesome. Wow. Yeah, definitely. So thank you so much, Liz. And I want to thank the Quincy Health Department for continuing to sponsor Aging Strong. Until next time, everybody, stay safe. Take care. Bye-bye.